Welcome back to Nysora YouTube channel, and today we're going to talk about 5 steps on how to insert perineural catheter at any location. And these 5 steps are extremely important to go through the motion each and every time. And throughout this instructional video, I'm going to point out some extremely important pro tips and tricks on how to make sure that your catheters stay in a therapeutic space. So let's get started. For this instructional video, we're going to use Nysora's reverse ultrasound anatomy of the interscalene brachial plexus. But here is the essential anatomy, and here we have interscalene brachial plexus. This over here is a C5. This would be the C6, which is split, and that will be the C7. And everything here that we are interested in blocking with the catheter is enclosed in the interscalene brachial plexus sheath. So that is that sheath. On top of these two structures, we have cervical fascia. So that's a cervical fascia. And underneath the cervical fascia, we have the middle scalene muscle. And here we have anterior scalene muscle. On the top of the anterior scalene muscle, here we have the phrenic nerve. And on top of the cervical fascia, this is the external jugular vein and elements of the superficial cervical plexus. Okay, so the insertion of the catheter, as we mentioned, consists of 5 specific, very distinct steps. Let's go through them. The step number 1 is the insertion of the continuous needle or needle inside the therapeutic space. In other words, the needle has to make its way inside the therapeutic space. And we do this today under ultrasound guidance, and we want to breach this fascia over here to insert the needle inside the space that contains the brachial plexus, inside the brachial plexus sheath. So that's step number 1. Once we have the needle inside the space, there comes the moment of truth, which is a step number 2. In step number 2, what we want to do is to confirm that the needle tip is inside the proper space. And we do that by injection of the local anesthetic. So let's just delete that for a second. But when the local anesthetic is injected inside the therapeutic space, then the brachial plexus basically moves away as a unit from the local anesthetic that is being injected through the needle. What we want to document is that the local anesthetic, once the needle is inside the space, pushes the brachial plexus to safety away from the needle. Step number 3 is now pass the catheter inside that space. So let me share with you a very important principle. Once we place the needle inside the therapeutic space, of course, step number 3, as we talked about, follows, which is insertion of the catheter. Now, what really happens here, needle is rigid and catheter gets a lot of support by the needle. Because we want to have the catheter at least 3 to 5 centimeters inside the therapeutic space, inside the brachial plexus sheath, as you continue advancing the catheter, oftentimes the catheter will have enough strength supported by the needle to penetrate through the sheath of the brachial plexus and end up into the anterior scalene muscle, which will result in a failure. So the question is now, how do we avoid this catheter exiting from the brachial plexus space or a sheath while advancing it to the desired length to make sure that it stays there? Well, the tip to that is that once you place your catheter inside the interscalene brachial plexus for about 1 centimeter, what you need to do then is increase the angle of the needle so the needle becomes more steep. And once you do that, then catheter immediately makes a slight bend, because this needle or reorientation basically bends the catheter. So now you have a catheter that is 1 centimeter inside. You can see this on ultrasound, and you can detect it by the skin markings looking at the hub of the needle, so that you know that the catheter is there already 1 centimeter. And the next step to this is to move this needle back slightly by 1 millimeter or 2 millimeters, so that now there's more catheter inside the space, and the catheter loses the support of the needle. And as you start advancing the catheter has no option than to start curling or making a loop inside the interscalene brachial plexus space. So this is the trick of the pros. In other words, once you place the needle inside and a catheter 1 centimeter, you increase the angle of the needle, you pull the needle while advancing in the catheter 1 to 2 millimeters, and then simply advance the catheter with or without ultrasound into the therapeutic space for 3 to 5 centimeters minimum. And that is the important trick that you can use in your practice to make sure that the catheter does not use the needle to penetrate the sheath and go outside the therapeutic position and into the anterior scalene muscle. The step number 4 is, now once we have the catheter in the space, now there comes the moment of truth again. We confirm the needle position by injection of the local anesthetic, but now we need to do the same with the catheter. We need to make sure that injection through the catheter now results in a spread of the local anesthetic in that particular therapeutic space. Now, this is easier said than done, because when you inject local anesthetic through the needle, injection through the needle requires minimal force and results in a lot of local anesthetic inside the interscalene space, which is easy to detect by ultrasound. However, when you try to inject local anesthetic through the catheter, its small lumen and the long duration and the high pressure required to inject makes the injection so minuscule that it is difficult to detect by ultrasound. For that reason, while the injection through the needle should be very slow and watching the injection pressure, the injection through the catheter should be super fast and forceful, so you can inject enough volume of the local anesthetic inside the space so you can detect it by ultrasound. So that's a very important step number 4. Injection through the catheter using high speed and force so you can detect the distribution of the local anesthetic. And finally, the step number 5 is, once we're done with this, we have to tape the catheter and leave it in a secure space. Thank you for watching. And if you liked the video, please do subscribe so you never miss our upcoming new videos. And likewise, do visit Nysora LMS. It is just an amazing resource, everything about regional anesthesia for anyone who wants to study or teach systematically. Until next time.